Hey guys, welcome back to the podcast. It's your girl Vivian Wogo. This is episode 2 of In Her Strength, and today I want us to talk about how I've been navigating my treatments, like the physical and emotional journey. It's not easy. It hasn't been easy. For some of you who has been following me on social media, you already know I come out and give you updates of the struggle. It hasn't been easy, but I feel like it's something we need to talk about on the podcast. My whole treatment plan was okay. It was first biopsy, and then after biopsy, I got a mastectomy. After mastectomy, I got axillary clearance, egg harvesting. No. I did biopsy. After biopsy, I harvested my eggs and froze them. After harvesting my eggs, I got a mastectomy. After mastectomy, I got axillary clearance. And now we are on chemotherapy. And after chemotherapy is going to be radiotherapy. Has it been easy? No, it hasn't been easy. But God has been faithful. God has been faithful because it has been a whole lot of sedations. And people will say, hey, it's just to give you medication so that you sleep. You think it's easy to just be giving medications to sleep. If it was normal sleep, why are we not taking sedation every day? Sedation has its own risks. It can cause lung problems. It can cause central nervous system issues. You can even sleep from there and be going and meet your maker. I didn't like the fact that I had to be put on sedation for most of my procedures. Physically, it has taken a toll on me personally. And let me talk about my egg harvesting. My entire surgery is normal surgery, right? But the egg harvesting is the one that is different from the normal surgery that you do. I used to work in a fertility hospital and I've taken part in egg harvesting before, but the type I had, they went in through my private part. But the ones I've experienced or I've assisted as a nurse, they went in through the stomach, like they put needle in, find the egg and harvest it. That was the one I had experienced, and I thought that is what it was going to be. But no, it wasn't. So generally, the procedure was done by women, so female doctors, fertility doctors, and I was sedated, so I was asleep when it was done. But before I went in, I was given a diclofenac pain relief to stop the pain in advance so that maybe the pain doesn't wake me up or something. They went in with the probe and found my eggs. Now, before we even got to the part of egg harvesting, my eggs had to be prepared. I was on a medication for, I think, 15 days or so. I really can't remember again. But I was given some injections that I had to be injecting myself. The injections that IVF people take, people that are going through IVF, they give them injections to help their follicles form, and not just their follicle, but to make sure that there is an actual seed inside the follicle, not just empty follicles. I started the injection immediately after my period. I started some of the injections and tablets, and then they were doing scans to look at to see how many follicles I was forming and all that. When it was time for the egg harvesting, they got good amount of healthy eggs out. And so they went in, like I was saying, they went in with the egg extraction, whatever they were using, and I didn't feel a thing. I was asleep all through. But the position you have to stay like the position of a woman that wants to give birth. But the bed is not flat. They put it down like this. Yes, they put it. Was it down? Oh, like this. No, they put it down like this. My head was up, a slanting way, but legs open. And they got out the eggs. When I woke up, I noticed that there was blood outside. They will be moving things like this, and that thing is sharp. Although it's like it's a closed mouth, when it gets to where the egg is, it now opens out up to extract it. But while it's trying to find its way, there will be wounds because after the procedure, for 1 week itself, I was still getting blood coming out. But the procedure was not I didn't feel anything, but when I woke up, I dealt with cramps. I was having cramps like crazy for days. So I was on pain medication. It wasn't easy. This journey has been so painful that there is no actual way to explain what it has been. But that was how it happened. The egg extraction took place. Then they told me how many they got out and put them in the freezer or a bank, something like that, and froze them. I have my eggs frozen, waiting for future husband. When we are ready, if we ever want children, we can go to the hospital and say we want children and we want our eggs fertilized. That's how it works. And I think the eggs are supposed to stay there for, I signed for 10 years or so. So the eggs are supposed to stay there for a certain period of time. And then if you don't need them again, they'll either get discarded or they'll be used to teach students. I didn't sign for mine to be used to teach students. Nobody is going to use my egg to teach anybody anything. But that's the situation. The egg extraction is one of the parts that actually made me very happy because I was already thinking I am not in a marriage that I am happy to have a child from currently. And I was also getting concerned about my eggs, right? If it was even best to go and harvest my eggs and put somewhere. I had that thought in my head. Sincerely, I've had that thought since 2020 after I broke up my marriage. But this cancer gave me that opportunity to preserve my eggs somewhere until I'm ready. That's part of the treatment and the surgeries I've had. Then the axillary clearance, for people that might not know, axillary clearance is when the lymph nodes in your axilla gets removed. After the mastectomy, during the mastectomy, my consultant brought out 5 lymph nodes. And out of the 5 lymph nodes, 3 of them had cancer in it, 2 didn't have cancer. She told me because of the odd that since I have 3 that have cancer, that it means that they will need to go in and bring out more lymph nodes just to make sure that the cancer hasn't traveled further. They did axillary clearance for me and brought out all the lymph nodes in this area from here to the back. I still haven't completely healed. This place is still numb, still healing. I don't know the kind of wound I have inside that place that hasn't healed up until now. But they cleared all these places. For life, I cannot get needle pricks on this hand. I should not stress this hand too much because if I do, there are no lymph nodes to drain the fluid. So it means that this hand will swell and remain like that forever, right? And I think it's called lymphedema or so, I've forgotten. But I'm not supposed to use this hand for anything carelessly. No needle pricks, because no, like cannulation, nothing like that, because if it gets infected, there are no lymph nodes to produce white blood to produce antigens that will fight against infection. This hand is defenseless right now. That is what axillary clearance is. They cleared all the lymph nodes in this hand. Dealing with the side effects and fatigue has not been easy. The side effects, first of all, some of you already know. I am always landing in the hospital because when it comes, you can't even do anything about it. Which one is what if side effect will I use to stop pain? Muscle pain, knee pain, fatigue, I mean, is you are awake, but even open your eyes is a problem. Roll in the bed is a problem. Get out of bed is a major issue. There's no way to deal with that. I just succumb because I remember somebody sent me a DM to ask me, how do I deal with fatigue? I don't fight it. I don't try to deal with it. I succumb to it. If I can't get up, I can't get up. I'll lie down there until I have the strength to get up. I tried buying a blood tonic. It helped for I think couple of days, and now it has no effect anymore. It doesn't do nothing for me anymore. And then sometimes you'll deal with constant headache. All you can do is take pain relief, paracetamol. Sometimes it doesn't even work. So you have to just keep dealing with it, allowing it to flow the way it flows. The mouth sores, I got mouthwash from the hospital, and also I always have gum with me. So the more I chew gum, the more my mouth is busy, so it doesn't have time to continue to build the mouth sores. That's how one of the ways I manage with mouth sores and fatigue. I don't fight fatigue, I succumb to it. Then another thing that I deal with is hair loss. For hair loss, immediately I got diagnosed, I knew that at some point I'll have to lose my hair. And because I've had a traumatic experience with hair loss, alopecia, years ago when I was dealing with, I didn't know I was stressed. I started losing my hair. I was scared. I freaked out. I tried everything I could until at some point I met a pharmacist that told me what to do. She kind of told me to take B complex actually and reduce stress. And that was what helped my hair grow back. And then I stopped using relaxer because I realized relaxer was affecting my immune system. Whenever I'm using relaxer, then I start losing my hair. So I stopped using relaxer for a couple of times for a while. That was how I dealt with it. When I got diagnosed, I knew that at some point I'll have to lose my hair, and I don't want the sickness to take my hair. I decided to cut my hair when I was about to start chemotherapy. Now I'm losing my hair because of the treatment, but I can't notice it because I've already cut my hair, if it makes sense. I didn't cut my I cut my hair to prevent me noticing when I start losing my hair. Not like I don't notice it, but to significantly see a chunk of hair gone and then your other part is remaining. I didn't want that. I cut my hair early enough. And I've seen a couple of people in the hospital too that did the same thing. When they were ready, they cut their hair so they don't experience it. Depends on what you want for yourself. And the anxiety, fear, and isolation that comes during treatment is nothing that I can explain to you about, because sometimes there are no words to put it. People don't even understand it. Even when you are dealing with stuff, they think maybe you're exaggerating things, maybe you're just acting. I remember a nurse once mentioned that my pains were in my head, that I wasn't feeling pain. People assume that some of the things that you are expressing are things that you are maybe over exaggerating, or because you're just looking for attention. But these are things that are actually happening. I know we are Africans, we don't know which one is anxiety, but we all deal with anxiety. There is no proper awareness about mental health in Africa. So when we're dealing with these things, we really can't put a name to it. But when you are anxious, you either get panicky, or you can't sit at a place, or you can't think straight. Sometimes anxiety comes in place of you just turning in bed. You don't have to be overly anxious when you are moving around for people to know that you're anxious. Sometimes your anxiety is just the fact that you can't concentrate on anything. So anybody that is talking to you, when somebody's talking to you, be like, please, I'm not even in the mood now. My mind is not that place that you're thinking. You are dealing with anxiety. This is for people that don't know how to put a name on how they feel. I've tried my best to figure out how I get anxious. So sometimes when it gets too much, I take my medication. I take a medication for it. But when I can handle it, I try to divert my attention, like seeing a movie or creating content or watching content. Also, I got signed up for mental health well-being by NHS. I go for therapy, and my therapist does a very good job. I'm the first child in my family, and it means that most times people don't know what I'm dealing with. It means that I have this savior complex. I want to save everybody but myself. But when I go for therapy, she lets me talk and she asks me some questions. Do you want to be taken care of? Do you sometimes feel like you need to be taken care of? And these questions make me cry, because I really like my inner child is crying for help. She wants to be taken care of. She wants people to care about how she's feeling. She wants people to ask her, do you need something? She wants people to help her without asking. She wants to be loved without giving something, right? But because it's hardwired in here that your that love has to be transactional. So sometimes when people freely give it, I don't freely receive it until I've invested back, until I've it makes me do too much than I'm supposed to, because somewhere in my mind I feel that I'm not worthy of love. And that is one of the things that NHS therapy sessions has really helped me to come to terms with. And that's how I've been managing my mental health. Is when it comes to my mental health, it's been a very progressive one, and one that I am happy about, because at some point after leaving my therapist office, I leave excited and happy and heard and seen. I feel seen, I feel heard. People can tell you they love you all they can, but they really don't know you. They can't see you, they can't hear you. Even when you are talking, they can't hear you. They are so deaf that even if you scream from now to tomorrow, they still cannot hear you, because what you're actually communicating is not what they are hearing. But my therapist makes me feel heard and seen and cared for. She lets me look in to see that I'm not taking care of me. Everybody else is important but me. And she's the one that helped me also to start paying attention to me, because paying attention to me will mean that I have to be selfish in some situations, and that is the only thing that will actually make me happy. It has really helped me in that way. If you can register for therapy. If not, if you I think Reverend Fathers do this too. You can actually book a session with a Reverend Father and say, please, I need somebody to talk to. Go to a Reverend Father that you don't know and dump your trauma on them. Talk to them, because talking helps. Even though they are not going to do anything, just like in my therapist's case, she can't do anything for me. But sitting and listening to me while I actually say what I really, really want to say, those things that you really want to, let's say to your mom or to your dad or to your boyfriend, and you can't say, or when you say it they don't hear you the way you want them to hear you. These people can listen to you that way. Your therapist, your priest will actually pay attention, even if they can't take action. But the way they make you talk about what you really want to talk about has a whole lot of positive impact in your mental health. That's a tip. Go to your Reverend Father. Apart from that, I've got a very good support system too when it comes to my friends, because as some of you also know, I have no family member coming around to take care of me. Recently, I got a cousin of mine came to visit. He came to visit for a couple of hours, even came and slept off in my bed because UK is showing him Shagabanza. There is no actual family member that is here to help me deal with what I'm dealing with, to help me to pick up anything or wash my clothes or cook for me. But my friends have done that. I have my friends cook and send over to me. I even have my Instagram friends, right? People that I have met through posting my journey. I've had a doctor, Dr. Kat, thank you so much, place an order for me to have 1 week food supply. And then I've had my friends like Lizzie, Chisom, AJ make sure that I have food in my house, in my fridge. Elena is always there. Elena is like my fairy godmother. That one has left friendship. She has left sisterhood. She has entered to mother. And then I have Tochi. Tochi is my childhood friend too, who is also very, very supportive and always there to check on me. I love my circle so much, and they've been extremely helpful, and I wouldn't have it any other way. What I'm trying to say in this is that sometimes you might not have the support that you want from your family because of some things. Sometimes the situation might not allow your family to be there for you the way you want them, but make sure you hold on to people who are actually interested in helping you out. And a couple of times I've tried to self sabotage by picking fight with the same people that take care of me. Don't be like me. Don't be like me. Don't fight people that are taking care of you. We're going to stop here today, and I'm going to leave you with this word. If you are on this journey, you are on this path, just know that you are not alone. There are people like me that are on this journey with you, and we're here to support you. And also, another thing is, it is also very good to share when you're dealing with stuff. Talk to people. In my case, I had issues with my salary, and I had to tell my audience what was going on. And some of them asked me to set up a GoFundMe account. I set up a GoFundMe account, and God has been faithful. I'm going to put the link in the description just in case you also want to donate. Please help me spread the word. I still need your help because I'm not done. And there are also people on this same journey that I might want to also support. All I'm trying to say is if you're on this journey, please do not shut people out. Talk to people. You never know where your help will come from. You never know what God has in store for you. I love you. Thank you for staying to this point, and I'll see you in the next episode. Bye.